Most of my migraine patients, they will say that they have classic triggers like this. For some, they say when they go under the sun they get headache. For some, if they do exercises in the gym they get headache. For some, if they fast or if they don't eat on time they get headache. But all these triggers has a common confluence point, which is the inherent biological predisposition. It is usually the C1, C2, C3, the cervical nerves and the sensory component of trigeminal nerve are the real nerves which are going to cause the headache. So for producing headache, you have to have these nerves to be irritated. These nerves are interacted in the cervical spine, maybe the middle cervical spine or the upper cervical spine, which produces the headache. So here the triggers are merely a trigger which interacts with the predisposition of the individual or the vulnerability of the individual. That means he is already having the problem, he is just waiting for the trigger to exhibit the outcome, which is the headache here. The headache here is the outcome of some predisposition which is already there in the body, which is triggered by these factors. So this predisposition is usually because of the disc nerve interaction complex, which is already irritated or inflamed in the cervical spine. Most common reason is the cervical spinatus, which also causes the neck pain. The same thing will cause the headache. So as a doctor, I will not, or even I cannot treat all these triggers, because these triggers are common and universal for all human beings in the world. Only some biological types or the patients who are having the predisposition are getting affected by these triggers. So we treat the predisposition or the vulnerability of these individuals by correcting the pathophysiology of the problem. Thereby the triggers will no more be a reason for causing the headache. So if you have headache or even migraine, get a proper pathophysiology based medical diagnosis